So I have the pleasure of introducing Stephanie Roit. Stephanie started her career as a registered dietitian at New York Presbyterian Weill Cornell, where she has worked with oncology patients for over 6 years. She completed her dietetic internship at New York Presbyterian in 2016 and has a master's in clinical nutrition and a BS in biology from NYU. She is a certified specialist in oncology nutrition. She co-authored the CCF booklet, Nutrition and Cholangiocarcinoma, a topic she's going to speak to us on this afternoon.
Thank you so much, and I'm really excited to be here today to talk about my favorite topic of nutrition with so many of you. I do work with a lot of cholangiocarcinoma patients one-on-one, so it'll be nice to be able to talk, more generally as well. And some of the things I'm hoping that you'll get from today's talk are to just understand a little bit generally about the relationship between nutrition and cancer. Also to understand some of the benefits of plant-based foods, which I'll explain a little bit more about later. There's also a lot of common questions that I get every day, and also the foundation also receives on some more specific topics such as the keto diet, fasting, sugar, and the alkaline diet. So I'm just going to quickly review kind of the current state of research with those and how that might relate to someone with cholangiocarcinoma. So just generally, nutrition is very important because it's the source of our, body's main energy. So it's something that we see can be heavily impacted by treatments, chemotherapy, immunotherapy, surgeries. So I'll commonly have patients that have taste changes, nausea, other digestive issues that might make it hard to maintain nutrition status. When eating well, it can help to improve quality of life and functional status during treatments such as chemotherapy. So it's really something that is very important for anyone who's had a diagnosis of cancer and cholangiocarcinoma. Malnutrition is one of the first topics that I would like to talk about just because it's one of the topics we probably have the most research to support, that preventing worsening of malnutrition can be so helpful for helping somebody to tolerate a treatment. So I'm going to talk about two terms. The first one, malnutrition. The common signs that you would experience would be weight loss, decreased nutrient intake, loss of muscle mass. And then we also have, similarly, a term called cachexia, which is a syndrome of muscle loss that's actually associated with inflammatory conditions like cancer and some others. Both of these can cause increased fatigue, they can cause treatment delays, and also more toxicity from some of the treatments we've been learning about today. So preventing malnutrition is the overall key, and if you're experiencing these signs of malnutrition, what we want to do is try to help you eat a little bit better so that we prevent that from worsening so you feel strong through all your treatments. Now, I did want to give some general tips for nutrition, which can be very hard. So you can see I put just a couple examples of some of the diets that you might be asked to follow during your treatment journey. So you might be asked to follow a high-protein diet before a surgery. Maybe they then say to follow a low-fat or a low-fiber diet after surgery. Maybe you're having some side effects and you might need to do more of a blander diet. So it's hard to give general overview, but there are some things that if you're feeling up to it, we do really recommend you include. So the first thing is trying to get enough protein from various sources. When I was talking about that malnutrition before, what we really want to do is focus on preserving muscle mass because that's going to give you your biggest source of strength. We see in studies that people going through chemotherapy that lose muscle mass tend to experience more fatigue and side effects. So I talk about protein with almost every patient and how important it is to incorporate that. Also, fruits and vegetables, we'll talk about those and other plant foods in general. If you're able to eat them and find ways that you can make them appetizing and ways that you can tolerate them during treatment, those are also going to be very important to include. Limiting ultra-processed foods. So ultra-processed foods are foods that you don't really see the whole foods in them as well. So that's something where they might have a lot of additives, a lot of added sugars and added fats. So you're not really seeing those whole foods that have all of these good cancer-fighting benefits. So while there might be a time and place, if it's convenient, it's what's available to you, in general, we want to try to incorporate other foods in the diet that do have a lot more cancer-fighting properties. Now, if you're able to, it is helpful to also meet with a personal registered dietitian The booklet that we authored for the foundation has some information on how you can find an oncology certified dietitian near you. So if it's not available at your center, you can look and see if there's maybe someone nearby. If not, I highly encourage you to download the booklet because we tried to put as much information as possible for people that are looking to, manage side effects and after certain surgeries. So there's some recipes in there. So hopefully that's a really good resource if you're not able to meet with someone personally. Now the first, dietary pattern I'm going to talk about is the whole food plant-based diet. And this is the general recommendation from the American Institute for Cancer Research across the board for anyone with a diagnosis of cancer or for even preventing cancer. It's associated with a lot lower levels of inflammation in the body, and that's usually due to the incorporation of plant foods, which are whole grains, fruits, vegetables, nuts, seeds, beans, all of these foods that are originating from a plant-based source. The reason I really like the whole food plant-based diet idea is that it does allow for a lot of flexibility. So one of the things I talk about when creating an individual nutrition plan for a patient is what are their preferences, what are their cultural foods, what are your digestive issues. So there's usually a way that you can incorporate all of those things into this eating pattern because it's flexible in definition. You can include animal products, which can be helpful for maintaining muscle mass, but also we're going to get a diet that is high in fiber and in antioxidants. Now, why is eating these foods that are high in fiber and antioxidants so important? Well, we have something that's called the microbiome, and it's basically all the microorganisms that are associated with the human body. A lot of them are found in our digestive tract, so you can imagine that food plays a big role. It's affected by many different factors. I just put a few of them here, such as your genetics, our environment, what we're eating, medications. There are so many other things that we're learning about are affecting the microbiome. So the diet is primarily what I'm going to just talk about today. And I will say research on the microbiome is still in its fairly early stages, but we are seeing some exciting things in regard to the microbiome and cancer. So in general, when we eat all of these plant foods that are rich in fiber, we're actually not fully digesting that fiber, but all of these microbes that are in our digestive tract are kind of working on those to create what we call metabolites. And these metabolites that it's creating have the potential to have good effects in our body, such as increasing inflammation, which again, cancer is an inflammatory disease, so we want to try to help that balance a little bit. It can help with digestive motility, which again is helpful when we think about people that might be having side effects of treatment, such as constipation. And also we've seen that people that have diverse microbiomes tend to have improved, it can protect against digestive infections. So all of these really good things that come from these plant-based foods and its actual interactions with all of these microbes in our gut. Now, plant-based foods also are rich in what we call phytochemicals and antioxidants, like I mentioned earlier, and these have the potential to decrease inflammation in the body as well. I put a nice colorful picture up here because actually a lot of times the antioxidants and phytochemicals in our food are actually found in those colors in the food. They're the pigments in the food. So you may have heard the kind of standard advice of eat the rainbow, and it's actually very good advice because you're going to get a lot broader of nutrition that way, and you're going to get all different of these phytochemicals and antioxidants. They seem to act in many different ways in the body, and again, we're still learning more and more about them. But in addition to decreasing inflammation, they can also help block or remove carcinogens in some studies, and also they might help prevent cell damage. Now I'm going to transition to talking a little bit more about some of the specific questions that I get on a day-to-day basis, and also the foundation gets a lot of questions on too. So one of the most common ones is the ketogenic diet. I'm sure most people in the room have heard of it, called keto for short. And ketogenic diet is actually a very high-fat diet that was originally designed for use in a treatment for epilepsy after medical treatments had kind of failed. And so the classic keto diet is a very high-fat diet, and what you see here, where up to 80% of the calories that someone is eating is coming from fat. It varies from what you might hear, your neighbor or someone in the community following a keto diet. That sometimes tends to be a bit of a higher protein, high-fat diet. But in the classic keto diet, you're actually also following a low protein diet as well. In some studies, they're using modified keto diets that do also help to shift the way our body's metabolism works. And there are some studies that are being done in cancer as well as other conditions. Some of the current ones that are going on are with brain tumors, endometrial cancer, and with a very specific type of targeted therapy, and there's a somewhat new trial recruiting for pancreatic cancer. Now, a lot of times these are coming from studies that have been done in mice, and one thing that's really important to consider is that in these mice studies, we've actually seen varying responses to the mice that were getting the keto diet. So some cancer types actually saw a negative effect from consuming the ketogenic feed, and others saw promise only when it was combined with specific targeted therapies. So it's something where we're hopefully going to have more information on where the keto diet might be beneficial, but at this time we can't across the board say that it's something that everybody should follow. And also in some cases it was shown to be detrimental in animal models, so we really want to be careful about implementing it too. And we unfortunately don't have any clinical trials for cholangiocarcinoma, but hopefully as we get more time, we'll see a lot more GI cancers across the board. Now, just to talk a little bit about the keto diet and the context of cholangiocarcinoma, the fat content of the keto diet might be hard to tolerate for someone who has had surgeries or who's going through treatment for cholangiocarcinoma. Depending on how you're doing the diet, it might be a little bit low in antioxidants and fiber, which again are those key benefits to the body that we saw from the plant-based foods. It also tends to be higher in saturated fat and processed meats, which are things we generally recommend keeping to more of a minimum in the diet. And side effects of the keto diet can also include constipation and weight loss. And remember, I started my talk with malnutrition, how we want to try to reduce that muscle loss. So sometimes we don't necessarily want that as a side effect of something that you're going to pursue. And because we don't have yet any safety studies in animal studies or human studies showing the safety of it, at this point we just don't have anything to recommend the keto diet in cholangiocarcinoma. This was a nice paper too, written by some doctors that are at Memorial Sloan, which is across the street from where I work in New York City. And you can see they're actually talking about basically the various benefits and potential benefits to cancer reduction from the whole food plant-based diet versus the ketogenic diet. So you can see there are some shared benefits in the pink boxes where they can have an impact on better control of glucose levels, reducing inflammation, but we see there's a lot of additional benefits from the whole food plant-based diet. So again, we're just seeing a lot more research that's supporting the whole foods plant-based that we can get versus a more restrictive diet like the ketogenic diet at this point. Now, probably the most common question that I get is, does sugar feed cancer? And I think it's something that we read a lot online, and sometimes studies can be a little bit misconstrued. And it's not a simple question to answer the way that it's typically asked of my patients. So glucose or sugar is the main building block and the main energy source for most of our body's cells. So cancer cells also use glucose, but they also use other fuels. So all of our foods that we're eating, whether it's something like a bowl of fruit or a whole grain sandwich or a cupcake, it's still going to break down into those basic building blocks. So from what we know now, there are not human studies that support completely avoiding these foods that break down into sugar. So I think this is one of the big things I like to share is that people can be afraid of consuming things that might have a little bit of sugar, but with what we know now in the human body, you can safely incorporate these foods in a way that can be balanced, which I'll talk about later. Now, why does this question get asked? I think, cancer cells have abnormal metabolism. In vitro studies show that they have increased use of fuel, including sugar. So I think a lot of times when studies are interpreted in the media, they'll kind of show that relationship. But it's very different when we look at sugar intake in the human body. So when we eat food, there's often other components to that meal. There might be other things like fiber and protein that slow down our digestion of those sugars. So it's not going to respond in the same way than if you're looking at cancer cells in a petri dish. Now, there is an indirect relationship between excess of what we call added sugars, and I'll explain that on the next slide, that may cause an increase in inflammation over time when you're consuming a lot of them. Sugary beverages and these added sugars consumed in excess might increase cancer risk. We do see kind of a neutral association, or in a couple of studies we have seen that as well. But we also see that higher fiber carbohydrates, a lot of those plant foods we were talking about earlier, actually decrease cancer risks. So it's not where we want to completely cut out carbohydrates or sugars. We just want to think about where are they coming from and how can we balance that with other things that we're eating. So added sugars come from a refined source. So this would be table sugar, maple syrup, honey, something where it's basically only the carbohydrate. You're not getting a lot of other nutrients with it. Some of them might have some trace minerals, which can provide some slight benefit, versus a natural sugar, which is where it's a carbohydrate that's going to break down into sugar. So this would be fruit, whole grains, starchy vegetables. They have lots of vitamins, minerals. They might have fiber, protein, other things that affect how they're digested in our body. So just key to note that fruit does contain natural sugar, but there is a distinction from that when we talk about it. Added sugars, they actually redid the nutrition label a few years ago, so you can actually see in your foods which ones contain added sugars, so it can be a very helpful tool. The leading sources in the United States as far as consumption of added sugars comes from sweetened beverages, snacks like cakes, cookies, and desserts, and then those processed or ultra-processed foods where they might add additional ones. Now, added sugars are the ones that we want to be cautious about how many we're consuming in the day. So again, it's not that we need to completely avoid these foods, but we might want to think about the amounts that we're including. So when we talk about cancer being an inflammatory disease, we might want to consider sticking within the guidelines for added sugars. I like the American Heart Association's guidelines because they're easy to understand, which is to limit to less than 6% of total calories per day. What does that actually mean in the day-to-day? Between 6 to 9 teaspoons. If you're looking at a nutrition label like I showed you on the last slide, I also left the grams in there, which would be about 25 to 36 grams per day. So when you're feeling good, not having side effects of treatment, and it's a good idea to try to be mindful of foods that have these added sugars, and so you can just keep within the recommended guidelines. Now, because we don't want to completely avoid foods that we really enjoy, and there's some tips for enjoying sweets in a healthier way, or to choose ones that are made with some whole grains or higher protein flours. Keep your portion within those recommended guidelines that I talked about on the last slide. Choosing unsweetened beverages, just because that is where we see a little bit more of an association with inflammation, so it can be an easy way to reduce by either diluting or just reducing your total portion of those sweetened beverages. Also trying some whole foods, some of these whole plant foods that have other nutrients in them, so you can get your sweet flavor, but also get a lot of other benefits from those foods. Some of my favorite examples are dates with peanut butter, dark chocolate, or yogurt with honey. And then the next topic I'm going to talk about is fasting. So fasting is another topic that has a lot of research in different areas for health, and I think a lot of people are talking about it right now. And it does have various definitions. So usually it involves an eating window where all food is consumed. So there might be an 8-hour window or 12-hour window where that's where you're eating all of your meals for the day. There's been studies looking at if it affects weight loss, if it may potentially enhance chemotherapy, or if it might have impacts on longevity in the general population. But the studies that have been done specifically with cancer have been either animal studies, very small studies, or in breast cancer trials where they're receiving very different treatments than cholangiocarcinoma. Now, we don't have a clear benefit yet because the research here is still very early, and we don't have studies in cholangiocarcinoma or any hepatobiliary cancers or really many digestive cancers. And part of that may be that any trial like this, we wouldn't include someone who's experiencing signs of malnutrition, and up to 85% of digestive cancer patients might experience malnutrition at some point in their cancer treatment. Possible side effects might also include weight loss, fatigue, and dizziness. So those are things that we want to try to avoid during treatment so that you feel your best. Doing a time-restrictive eating where you're eating within 12 hours of the day might be safe to do as long as you're working closely with a dietitian or your medical provider, that you're not losing weight or muscle mass, which we know is so important. But it wouldn't be appropriate for someone who might be experiencing malnutrition. And then the alkaline diet is, I believe, the last one I'm going to talk about because we do get a lot of different questions, so we tried to pick the top ones. And this includes diets that are what we call alkaline with a higher pH and restricts foods that are acidic with a lower pH. And this includes many plant-based whole foods, which we talked a lot about, the benefits of. But it does also, unfortunately, have a lot of unnecessary restrictions of other foods that can be healthy. Now, pH in the body is just that balance of acid and base, and the blood pH must be tightly controlled. Your body's going to adjust its output of acid and base depending on what you're eating, so you're not going to dramatically change the pH of the body by reducing, those foods. There's no evidence to support the alkaline diet for any cancer types. Researchers actually attempted a review paper of the literature, and they actually couldn't even find enough papers to do the review. So it's something where I think it gets talked about a lot, but we don't have a lot of research to base that on. It does have a lot of unnecessary restrictions as well, so limiting protein-rich foods, which can be so helpful for maintaining muscle mass and strength and reducing fatigue. It also limits whole grains, which we see have a good effect on that microbiome, which can really help reduce inflammation and can be helpful for managing digestive symptoms as well. And so I think this diet can really contribute to malnutrition, and we just don't have benefits from any research to show that. So if I had takeaways, I hope what you take away from this presentation is that there isn't a one-size-fits-all for nutrition with cholangiocarcinoma, because you might have a lot of changes to your appetite or your digestion during treatment. So we do know that these plant-based whole foods do have a lot of cancer-fighting properties and potential benefits in the body, so we do want to try to encourage those where we can. Restrictive diets are likely not beneficial with what we know at this point and might lead to malnutrition. And the biggest thing you can do is support your body, support your healthy cells, and support your muscle mass so that you tolerate your treatments and feel the best energy that you can. Also, all foods can fit, so trying not to fear foods that you might read about on the internet, because it really is different when you're looking at a specific component of a food versus when you're talking about eating that food and it being digested in your body. So I try to work with my patients on that a lot, is trying to incorporate foods that you like, that are culturally important to you, because I think that's very important when we're considering nutrition for someone with cholangiocarcinoma. And then if you have the option, again, meeting with a registered dietitian really can help. So if you have that option, that can be very beneficial, especially now we're seeing more telehealth. Hopefully it's something that's available to more people. But again, the booklet from the Cholangiocarcinoma Foundation is a really good start that was written by a couple dietitians, including myself. So if you don't have access to that, that's a really great place to start. Thank you. That's all I have today.